Welcome back to the Rich and Mo Physiotherapy series. Today we'll talk to you about ankle sprains, injuries to the ankle. Moshe.
Hi Richard.
Hey.
So ankle sprain are one of the most common injury we see here in the clinic. I think that on an average week I see 4 or 5 patients that come with certain degree of ankle sprain. First thing to know about ankle sprain is that it has degree. Not all ankle sprain born equal. There is the first degree, which is a stretch to the ligament. Here we have the foot model. When we talk about ligament, we talk about most of the time, in 90% of the ankle sprain, about the ligament that is located in the outer part of the foot. Okay, it's called in professional language ATFL, anterior talofibular ligament, and this ligament job is to keep the stability of the foot. Okay, to prevent this from happening. This poor guy doesn't have a ligament, so see what happens. Okay, so what happened in first degree? There is some stretch to it, nothing dislocate, nothing tore. Usually if you are playing sport, you have this, you will be able to continue play. Afterwards, when you take your shoe, you will see that your foot is swollen, it will be painful to step, but usually if you can continue playing, it's first degree ankle sprain. Second degree, you are unable to play and there might be some sign of internal bleeding, what we call hematoma, in here that will develop over the course of the next few days. Third degree is a complete tear of the ligament, okay? So we are mostly focusing now on first degree. And what are we doing in case that it happened? Emergency care for it. So we're doing something that's called RICE. RICE stands for rest, ice, compression, and elevation. The first thing we need to do is rest. Rest doesn't mean stay in bed. It does mean that you don't have to do all your regular job or go back to sport activity, but you have to get some relative rest, not to stress the tissue too much at the first 72 hours following the injury. One thing that you can do, and we will demonstrate it afterwards, is what we call pumping action, which means relative movement of the ankle in pain-free movement. Second thing is ice. For about 15 minutes, 3 or 4 times a day, put ice around the ankle just to let the swelling get down a bit. Compression means 2 options. My favorite option is to put a brace, something to give some support and also to create some compression on it while we're walking in order not to let the fluid accumulate in there. And the last one that we have is in the RICE is elevation. When you lie down, just put your foot on 2 or 3 pillows and keep it higher than the level of the body so the fluid will have easier way to get out of the ankle. So these are the basic to know about ankle sprain. If you try to do it for 2 or 3 days, usually I recommend to people to come and consult physio after ankle sprain, even after not a very serious ankle sprain, grade 1. Also come to watch a physio just to make sure that you are able to go back to your sport, to give you some additional guidelines to prevent complications. Sometimes 1 or 2 treatments can save you a lot of sorrow and pain in the future.
So now to demonstrate a very simple exercise to do right at the beginning when you get your ankle sprain is a very simple ankle pumps, as we call it. You're lying down and you're moving your ankle and foot up and down without pain, pain-free range. You could repeat this 30 times, 3 times a day, as long as there's no pain, as long as you're doing it without any pain. Now the importance of doing physiotherapy for an ankle sprain, just to give you an idea, is that we're starting with these simple exercises, but soon you will want to progress the exercises into something more advanced, and the training, and as Mo will show you, the training will end up towards the end of your rehab to look like exercises like this, what we call proprioception, balance, coordination exercises. So he's balancing on one foot and getting that ankle really at extreme motions to get it ready to go back to play. Because as you're playing soccer, football, anything like that, your ankles want and will go through these motions, and you want to prepare them for play. And we got other more extreme exercises where you're jumping and balancing on an unstable surface. And look at that ankle, how it moves, and then what we call plyometric exercises, the jump and land.
By the way, this specific ankle, I had a very severe ankle sprain and tore a ligament about a year ago. So you can see how much real-time rehabilitation what it was doing, because I worked hard on it. I have the privilege of being a physio, so I didn't actually have to pay for the treatment. But I worked really hard on this, and now I think that I can do almost everything with this ankle. Enjoyed our video?
Please like and subscribe to our channel.
Thanks for watching.